Dear students, today we will go ahead with a very interesting and important topic in the lower limb, that is femoral triangle. Femoral triangle is a triangular depression present in front of the thigh. So if we see in the upper one-third of the thigh, the triangle which is present on the medial upper one-third anteriorly in front is the femoral triangle. So if we see its outline, this is the triangle. So the apex of the triangle is directed downwards. Base is formed by the inguinal ligament. And apex is formed by the meeting point of medial and lateral borders. So this triangle is clinically quite important because big neurovascular bundle which is present in this femoral triangle, where we can see a vein, artery and nerve. The vein and artery are femoral vessels, femoral artery and vein, which are important access for to reach the heart or to reach the brain for interventional radiologist. So during any intervention to put a catheter, these two are often chosen blood vessels because they are quite larger blood vessels. So that is the reason this triangle is clinically quite important. And let's see the boundaries of femoral triangle. It has got a lateral boundary, medial boundary, base and apex. So here is the outline of the femoral triangle. Base is formed by the inguinal ligament. Apex is formed by the meeting point of medial and lateral borders. The lateral boundary is formed by the sartorius. To be specific, medial border of the sartorius. And medially, the medial border of adductor longus. So part of the adductor longus forms the floor of the femoral triangle. So these are the boundaries of the femoral triangle. Let's see the floor. The floor, it is gutter shaped and it is made up of completely muscles. So from lateral to medial side, it is formed by iliacus. So the lateralmost muscle is the iliacus. And next to the iliacus, the tendon of psoas major. Iliacus and psoas major both are the flexors of the hip joint and both converge forming a iliopsoas tendon which gets inserted to the lesser trochanter of the femur. So both are together forming the lateral side of the floor of femoral triangle. So next is the pectineus, and medial to the pectineus is adductor longus. So these are the muscles forming the floor of femoral triangle. The roof of the femoral triangle. The roof is covered by the skin, superficial fascia and contents of it. Here is the cross section along the femoral triangle exposing the contents, and the other side we can see the femur here. This is femur and the muscles present in the floor, lateral to medial. So which is lateral, which is medial in this cut section? So the lateral one will be the artery here, arterial side. The medial side is, you can see the vein here, and next to the vein, this is the femoral artery. Along with it, femoral vein. And most medially, we can see the lymph node, called as femoral lymph node. So all this I will discuss little later. They are present in a sheath called as femoral sheath. The nerve, femoral nerve, is present outside the femoral sheath. This is the roof. So the roof is formed by the skin, superficial fascia. So deep to the superficial fascia is the deep fascia. In the thigh we call it as fascia lata, And fascia lata contains an opening called as saphenous opening, where the great saphenous vein opens into the femoral vein via this saphenous opening. Then superficial fascia over the roof containing the superficial branches of femoral artery. So superficial fascia contains superficial branches of femoral artery, femoral vein. So we also see within the roof the upper part of great saphenous vein. Upper part of the great saphenous vein is also a structure present within the roof of femoral triangle. So what we see in the superficial, that is the structures forming the roof, are superficial inguinal lymph nodes. Writing here. And also it contains the femoral branch of genitofemoral nerve. Femoral branch of genitofemoral nerve and the branches of ilioinguinal nerve. Just writing ilioinguinal nerve. So these are the structures present within the roof of femoral triangle. I'll just repeat again. It is formed by the skin, superficial fascia containing the superficial branches of femoral artery, upper part of the great saphenous vein, superficial inguinal lymph nodes, then the femoral branches of genitofemoral nerve and branches of ilioinguinal nerve. So these are the structures present within the superficial fascia. Then deep to the superficial fascia, the deep fascia modifies as fascia lata. Fascia lata shows a cribriform fascia, means a fascia containing openings, holes, called as cribriform fascia, exposing an opening called as saphenous opening. And as we know, the saphenous opening is present within the fascia lata. Even the upper part of the great saphenous vein present within the superficial fascia. And along with the upper part of the great saphenous vein, the tributaries of the great saphenous vein, which are superficial tributaries, present along with the branches of femoral artery. So all these are the structures forming the roof of the femoral triangle. And here it is a cross section. So we can see lateral to the medial side, we can see the iliacus forming the floor here. And this is psoas major. Iliacus and psoas major are together. And here is the pectineus. This is pectineus. This is adductor longus, which are the structures forming the floor of femoral triangle. Let's see the contents of femoral triangle. The main contents of the femoral triangle are femoral artery and its branches. This red one is the femoral artery and its branches, which are given off in the femoral triangle. Then femoral vein and its tributaries. Femoral nerve, which is present most laterally in the thigh. This is femoral nerve. And we have got some deep inguinal lymph nodes present medial to the femoral vein. And lateral cutaneous nerve of thigh, which is lateral most, and a part of it is present in the femoral triangle. So this is nerve of thigh. In addition to these structures, we also contain the femoral branch of genitofemoral nerve, so which is along with the femoral artery. See here, this is femoral branch of genitofemoral nerve. and also we have some fibrofatty tissue present within the triangle. So these are the contents of the triangle.